Hello everyone. Hopefully you all are doing well. I am Dr. Farhan Ishaque, Certified Health Professional Educator. Currently I am serving as an Assistant Professor and HEC approved PhD Supervisor at Dow Institute of Physical Medicine and Rehabilitation. What are actually rehab sciences? I would rather say it is a science of healing and art of caring. Rehabilitation is an integrated branch of medicine and allied health sciences, which is an essential segment of modern healthcare system. Let's have a look how this channel will contribute in rehabilitation sciences. Rehabilitation sciences include physical therapy, occupational therapy, prosthesis and orthosis, speech therapy, and clinical psychologist. All these fields are associated with each other and they are really value each other, and we learn from these fields as well. So if I may start from the introduction of physical therapy profession, I would mention as one of the fastest growing healthcare profession. Physiotherapy is a healthcare profession which assists people to restore, to maintain and to maximize their strength, function, movement and overall well-being. Physical therapists are movement experts actually who improve the quality of life through prescribed exercises, hands-on specialized techniques, and of course, patient education. Patients are re-educated to use their own muscles to increase flexibility and range of motions as well, to advance to higher level of muscular strength and endurance. Let's talk about the scope of physical therapy profession. According to American Physical Therapy Association, the scope of physical therapy practice is very dynamic, evolving with evidence, education, and societal needs. Physical therapy is a broad and fascinating field. Physios are working everywhere in the world and in so many different areas, of course, from private practice to ICU to stroke rehabilitation, from conducting research. What they all share in common is a passion to help people get back to doing the things they love. The professional scope of physical therapy consists of two main domains. I would say number one on patient management and the second one is academic domains. As far as the patient management is concerned, it includes diagnosis and prognosis to optimize physical function, movement, performances, health quality of life, and well-being across the lifespan of the patient. And as far as the academic domain is concerned, physical therapists can contribute in academic activities like, of course, seminars, hands-on workshops, teaching in higher education institutions as well. Now let's talk about what is occupational therapy. Occupational therapy is a type of healthcare that helps to solve the problems that interferes with a person's ability to do the things that are very important for them for activities of daily livings like self-care, getting dressed, eating, moving around the house, being productive, going to work or school, participating in the community and leisure activities, sports, gardening, and other social activities. The primary goal of occupational therapy is to enable people to participate in the activities of daily life. Now the next field is prosthetics and orthotists. Prosthetists are trained to work with prostheses such as artificial limbs and other body parts. Prosthetics career involve the designing and fabrication of medical support devices such as artificial limbs. And what about orthotist? An orthotist is a healthcare professional who makes and fits braces and splints for the people who need added support for body parts. Orthotists are concerned with the help of patients to regain mobility in an injured body part. Now let's talk about the scope of prosthesis and orthosis. The practice of orthosis and prosthetics occurs in various settings, including independent private orthotic and prosthetic practices, hospitals, inpatients and outpatients, rehabilitation facilities, of course in rural outreach clinics, home healthcare settings, short-term nursing facilities, and of course long-term care settings as well. Now let's talk about the speech therapist or speech language pathologist. They are the experts in communication. Speech language pathologists treat many types of communication problems like articulation disorders, apraxia of speech, or dysarthria. Speech therapists also deal with feeding and swallowing disorders. A swallowing disorder may lead to poor nutrition, weight loss, and other health problems, which is very serious. That is termed as dysphagia. Now let's talk about the clinical psychologist. A clinical psychologist is someone who works with patients to diagnose and treat mental and emotional disorders. Their practice is sometimes referred to as psychotherapy. Clinical psychologists meet with clients to identify their problems that could be emotional, mental, and behavioral. Through observation, interviews, and tests, the psychologist can diagnose any existing or potential disorders. Clinical psychologists are trained in a variety of techniques to deal with the different disorders. According to American Psychological Association, a psychologist focuses on the role of learning in acquiring behaviors, that is termed as behavioral therapy. They also focuses on changing people's thoughts to change how they feel and act, that is termed as cognitive therapy. They also focuses on people's ability to reach their full potential and the importance of respect for individuals. As far as the scope of the clinical psychology is concerned, they can work in different fields like a doctor, like a researcher, writer, sports psychologist, teaching in different institutes and universities in psychology departments. Friends, this is all about the rehabilitation concepts. Thank you so much. And your subscription will be a contribution to the profession. If you are intended to watch quality content regarding the rehabilitation, please don't forget to subscribe the channel.